All right, today we are stepping into the past. We're going to open up some historical medical texts to piece together a portrait of a substance known as Hyoscyamus Niger. We're going to see what these old school physicians had to say about the really complex state of mind it described. Let's get right into it.
So the big question we're asking is this. What picture emerges when you pull together all these incredibly detailed but really old descriptions of fear, mania, and suspicion? We're going to build what these texts call a symptom picture, piece by piece.
And just to be super clear here, we are looking at this purely through a historical lens. This is all about what the texts describe. It's an exploration of how doctors in the past documented the human condition. This is definitely not medical advice.
Okay, so where does this journey begin? Well, according to the texts, it often starts quietly. It's internal. It's this creeping, growing sense of mistrust and fear. It really is a portrait of paranoia.
And what's wild is just how many different fears are cataloged. I mean, it's not just a general anxiety. The texts talk about a constant dread of being poisoned or sold or betrayed, but then it gets really specific, with documented fears of water and even syphilis. The world for someone in this state becomes a really, really scary place. And here's where you see how that internal fear just spills out into real-world behavior. This quote, it just paints such a clear picture, doesn't it? A person so consumed by suspicion that they change their clothes every single day, trying to be someone else and basically become a prisoner in their own home. You know, another thing the texts really zero in on is jealousy. It's described as this incredibly powerful trigger, not just a normal emotion, but more like a spark that can set off an absolute firestorm of rage, delirium, and yeah, in the most extreme descriptions, even homicidal urges. It just shows how volatile this whole state can be.
So we've got this deep internal paranoia, right? Well, from there, things really start to spiral outwards. Reality starts to fray at the edges, and the internal turmoil just bursts out into the open as delirium and hallucinations.
The way the delirium is described, it's almost, well, theatrical. The texts use phrases like comical alienation of mind. The behavior becomes foolish, bizarre, like a clown or a monkey. It's a total disconnection from how a person would normally act.
But here's the thing. It's not always loud and violent. A key feature is what the texts call a busy delirium. Imagine this constant, low-level hum of restlessness, non-stop muttering, constantly fiddling with their hands, and just this deep need to be moving. The mind just cannot be still.
Okay, so let's talk about the hallucinations. Because the ones described here, they're not just some blurry visions in the corner of your eye. They're described as being incredibly real, vivid, and, well, interactive. And get this quote from the historical text by Kent is just, wow. It's such a perfect and kind of wild example. The patient isn't just seeing bedbugs. He has organized them. He's tied them up with a string, and he's getting actively frustrated with his own hallucination. That's what they mean by interactive. So another thing that comes up again and again in these texts is something pretty startling, a complete loss of shame. The sources frequently mention patients just throwing off their clothes, kicking off the bed covers with this constant desire to be naked. But here's the twist. The texts offer a really fascinating explanation for this. They don't chalk it up to lewdness or anything like that, no. They give a physical reason, an extreme hypersensitivity of the skin, a hyperesthesia, that makes the simple touch of clothing feel unbearable. So the action is driven by a sensory overload, not anything else. So, to really get a handle on what kind of mania we're looking at here, the old texts do something really smart. They compare it to a couple of other substances that were known for similar states, and this comparison really helps sharpen the focus of the portrait we're building. Okay, let's break this down. The texts put this state up against two others. On one hand, you've got belladonna, known for high fever and a pretty violent delirium. Then there's stramonium, which is described as even more violent. But Hyoscyamus, it's totally different. It's characterized by a low intensity, a kind of passive mania, often with little or no fever at all. Like the texts say, this is a delirium that mutters rather than shouts.
All right, we've spent a lot of time on the mind. Let's shift gears to the body, because this internal chaos, it isn't just psychological. It absolutely shows up physically. It's like the body itself is in revolt.
This quote from Guernsey, it just nails it. The number one most prominent physical sign described is this constant, widespread muscle twitching. And it's not just in one spot, it's everywhere, a ceaseless, flickering motion from head to toe. And this constant twitching can sometimes ramp up into full-blown convulsions.
The texts even note really specific triggers, like a sudden scare in children, or something as simple as happening after a meal. They also make a point to describe them as clonic, which just means they involve a lot of rapid jerking motions, not the long-lasting stiffness you might see in other kinds of seizures.
And this is where the detail in these old texts just blows my mind. They even drill down to a very specific, peculiar kind of cough. This is how they built their patterns. It's a dry, spasmodic cough that starts with a tickle. And here's the key pattern they observed. It always gets worse when the person lies down, and it gets better almost immediately when they sit up.
Even the tongue, believe it or not, is described as a mirror of what's happening inside. It can get so dry and cracked that it literally looks like burnt leather. In other cases, they describe it becoming paralyzed, which then leads directly to the person losing their speech or not being able to form words clearly.
Okay, so we've looked at all these different fascinating pieces. Let's pull back and put the whole portrait together. What are the big defining brushstrokes here? What are the key takeaways?
If there's one image that sums so much of this up, it might be this one, carphologia. It's the technical term for the constant, involuntary picking at bed sheets or reaching out to grab at imaginary little things floating in the air. This one action perfectly captures that busy delirium, the restless hands, and the twitching muscles all at once.
So really, you can boil this whole state down to 3 core themes. First, you have the deep psychological disturbance, all that paranoia and delirium. Second, you get the physical eruption, the twitching and the spasms. And third, you have all the behavioral strangeness, the muttering, the restlessness, and that impulse to be uncovered.
Which leaves us with this one big question to chew on. When we look at this incredibly detailed portrait, put together from observations made centuries ago, what are we really looking at? Is it a forgotten map of how the human mind can fracture under intense stress? Or is it just a curious relic from a medical world that's long gone? There's no easy answer, but it's definitely something worth thinking about.